Karen, Dr. Buford, we're just getting started on the left shoulder, looking in from the back to the front. We're just flushing a bunch of salt water through the joint and having our first look around. Everything is magnified about 40 times on the screen. And the first thing we usually find is the biceps tendon, which is on the right side of that cannula here. The biceps tendon actually looks pretty good. We'll tug on it, look at the anchor. And that looks pretty good. Again, we're going to flush a bunch of water through. That looks pretty good. So now we're going to look up, this is where the rotator cuff is torn. And what we're going to do is take a marker stitch so we can find this area very quickly on the other side of the tendon. We're going to look towards the back of the shoulder here. And as we look in the back, other than a little bit of inflamed synovium, see some of that redness in the tissue, that's really the only remarkable finding. And as far as synovitis goes, that's not too bad. I think the main issue at this point, based on what we're seeing, is the rotator cuff issue that we've already known about. You can see it right there at the top of the screen. Pause. Okay, so here we're using our shaver just to clean off where the rotator cuff normally inserts. Speeds things up in the repair when we change positions here in just a minute. So we can see where this tendon is completely detached through well more than 50. In fact, it's a complete tear as we look up through there. That's what we expected. So we're going to go ahead and continue to debride this a little bit more from the articular side here. And then in just a minute, we're going to go off on the video, change positions with your shoulder, and come at this from the dorsal side, which is kind of the top side of the tendon. Notice we're right at the articular margin here, and we're just in the anterior portion of the supraspinatus. Here's the tear in the tendon. To the right is posterior. You can see the hole right in the middle here, and then to the left is anterior. We can see the biceps tendon here, just there. That's the biceps tendon, so we're going to have to cover that up also. So the next step is for us to go ahead and get to work on anchoring this tendon back down to the bone. We're going to place a suture anchor and show you how we do that in just a second here. This is a spinal needle. We use this to check our angle of insertion. Looks like we're going to want to place an anchor down right about like that. We're not going to place it right there at the articular margin. We're going to come back about 5 or 6 millimeters, basically in the middle of the footprint, right about here. So we'll make a little nick in the skin. We'll pull the needle. And then we have a guide that we place down. There's our guide. And so we'll push this in a little bit more. Clear some of the soft tissue off. Okay, so the guide, we first place it at the articular margin, and we walk it back about 5 millimeters, like that. What you see through the little window there is the anchor. Camera just a little bit more again. Okay, hold right there. I'm going to take this and take it a little bit more posterior, just like that. And I'm happy with that position right there. Pause. Okay, here's the anchor in the bone. I'm pulling very hard and it's not going anywhere now, so we've got it seated. The next step is to go ahead and take one of the sutures out anteriorly. You'll see a gold instrument called a crochet hook coming through here. And it looks like I can pull back on the cannula a little bit. It looks like I can take one of these solid blue ones here and pull the cannula and pull that. Okay, and so now that's ready to go. On the right side of the screen, we're going to pass an instrument called the suture hook. Give Lauren the grasper. So here's the suture hook. We're going to take this through at about this angle here. I've got another instrument here called the grasper. grasp it, it helps me look underneath. See, I want that deep layer of the tendon as part of the repair here. So there you can see it's coming through. We'll go ahead and feed the relay. Pause. And now outside your shoulder, through that clear cannula, we're going to load the black wire with the blue suture there. Yep. And then we're going to pull back. You can see how that's going to go ahead and bring that through. We'll pull tight on it. And that gives us the first part of our repair. Okay. So now I'm going to reach in and get the partner suture here. But we're not going to tie these yet. We're going to go ahead and pass another stitch. And so in order to do that, I've got to reach back in from the left side of the screen. Go back from the hand a little bit. I'm going to get the next suture in line, which is this blue and white suture here. Second pass through. Pause. And as we pull out the relay here, you can see how it brings that blue and white suture out. Just like that. We'll reach in and get the partner blue and white striped suture. And now the final step is to go ahead and pass a suture from the anterior portal. We're going to get the final suture that we're going to work with here. We'll pull all these other ones tight. Okay, so now we're going to get the final suture, which is the black and white striped suture. We're going to pull it out posterior, so we're going to hold the cannula as I pull through. And now we're ready to pass a stitch from the left side of the screen. So we're going to pull out the anterior cannula all the way. Here's our next hook, as you see here. Little slip right there. And then we'll bring the grasper in. And we're going to decide how we're going to place this stitch. So obviously we don't want to stitch the biceps, but we do want to get the full thickness of the cuff. Okay. So it looks like we can go right about here. That's like a good pass. Pause. Okay, so we've got 3 sutures tied. I don't think there's room to put another anchor in. So what we're going to do now is do our little biologic augmentation by making some little holes in the tuberosity here. What that does is it opens up the bone marrow cavity and allows some of those stem cells there to come out. Yeah, a little farther.